So I warmly welcome you all, Dr. Kawal and Dr. I can see a lot of participants are active participating in the group, and thank you very much all. Dr. Muhammad Nias has raised his hand. Yes, Dr. Muhammad Nias, you want to say something?
Is there any way to join, participate?
Okay, so that will be, we have already some of our candidates that we have chosen, but if any one of them do not appear, so you will have given the chance. All right.
Okay. Thank you, ma'am.
Thank you. Thank you, Muhammad Nias, for showing your interest, and hopefully next time we're going to give you the chance, and we will keep it in mind. So I warmly welcome you all today for joining this very important topic, that is breaking bad news that is encountered almost by every physician during their lifetime. First and foremost, I must appreciate each of you for joining today. Your commitment for learning and active participation are driving the forces that led us to do more and more such webinars. So the topic for today is approach to breaking bad news. With along with this, there will be a communication mock in the end. Right. I will start with the communication flow chart. I have also done an orientation webinar before that, and for those newbies who are joining today first time and who don't know, so there is a YouTube channel on which you can see that webinar also about the orientation that is very vital. If you are new to the preparation of the exam, so I will recommend that first you should watch that webinar also, because in that I have told in detail about the breakdown of all the stations. So today our focus is only about the communication station. Here is the flow chart that there is total 3 minutes in the beginning of the station. When you are waiting outside, there will be provided the candidate information sheet, and there will be 3 minute waiting time outside the station. Inside the station, there will be 9 minutes when you will introduce yourself and the role player. And then you will start the communication, and before the 3 minute there is a warning bell, and at the 9 minute the station will end. So this is a general brief overview which I have already discussed before also. Today we will do the approach station, how to approach a communication. First I will tell in journals. So these are the key points when you are in the waiting area outside 3 minutes. So here the candidate information sheet will be provided. 3 minutes pass very fast. So there is also a plain paper that is available. What you are going to do is to read the scenario very carefully and decide about the category, whether this is a breaking bad news, this is a critical incident, information giving, what type of scenario is this. So decide on this category of the scenario. Then on the paper which is provided to you, the plain paper, write the name and age of the child and mother. That is very important, because when you go inside, you will forget the name of the child or the mother, or you say the name of the mother wrong, then this gives a very bad impression. And we obviously don't want to get a bad impression in the start, because it will ruin your all station. Then the task, then there is very important point is that you should write the key points in the short form. Like suppose there is these, nowadays they are keeping the candidate information, the scenario, they are very long. There is no time to read it again. So, and you have to write the key points in the short form so that you remember what was the point inside. Suppose there is a child with bruises, with fever, and what is the presenting complaint. Now the task is very important. So you should be reading the task very carefully and identify what task you are going to do. Let me tell you an incident here, like one of the candidates, he go into the exam and he didn't read the task properly. There was one scenario that is very famous nowadays, the restarting of feet in the neck. So when the candidate was doing the station, so mistakenly, he counseled mother all about the stopping of the feed. So it was done other way around. And interestingly, the candidate didn't know. And he was very happy after the exam, and only he know when the exam result was out that it was done other way around. and he get 1 out of 8 in this station. So it is very important. So the purpose here is to tell you that it is very important to read the task very clearly, and you should be knowing. This is a common mistake which most of candidates are doing, that they don't know about the task, what is the task and what they are going to do. Drawing, if the drawing is needed, that has to be done outside. You have no time inside to draw, and the drawing should be clear. It's not like you draw some very vague kind of drawing. It will not help. So 3 minutes are in the 3 minutes, if you have time and you know how to draw, and you have practiced already when you were doing your exam preparation how to draw, it's not needed to be very good or fine drawing, but it should give a value. If suppose you are doing a drawing, so it should give some information to the role player. Okay. So here we are divided the communication station into 3 parts. This is for the purpose of the simplification, that communication, it is done into 3 parts. First of all is the introduction, then is the main body, and in the end there is conclusion. So now we will be doing the step by step, every detail in detail about the every part we will be studying. This is about the introduction. Introduce yourself. Whenever you start, you have to do the introduction. So you have to introduce yourself. You have to confirm the identity of the role player, whether it is the mother or the child, it's the father. You have to confirm the identity to make the rapport to enter in the station. Then you have to take the consent for the meeting. Is this the proper time to talk to them? Then ask for the attender. Check about the previous knowledge. This is very important. So whenever you are doing this station, so in the introduction, these 6 things has to be done, because when you do these 6 things, there are marks for this each step. But what make you different from the other candidates is the body language and the tone of your voice, how you will enter into in your scenario or station. Suppose it is breaking bad news, so it is very important that you enter into station in a low tone, in a tone that is very soft, empathetic, and you don't a preamble in the introduction. So you practice introduction for all the scenarios. The good news is that introduction is same for every station, and you have to practice the introduction only once. You will remember this introduction for all the scenarios. This introduction is same. So till this point, everything is clear. Did anybody want to ask anything? Okay, I think that everything is clear till now. We will move forward. So this is the anchor statement from the Royal College of Child Health and Physician. They have brought this domain E1, in which they are checking the communication skills, the rapport, and the communication style. In which you should have appropriate level of confidence. Your greeting should be proper. You should introduce in a professional way, sensitive, appropriate body language, should respond to verbal and non-verbal cues. Develop the appropriate rapport with role player, put at ease, clarify the role and the agenda. Appropriate tone and pace is very important. For all of the candidates, introduction is same, but here you stand out when your voice tone is good, your pace is good, your body language is good. So that will make a difference. What is open body language? Can anyone of among the audience can tell me how is the open body language and what is the appropriate body language? Yes, Dr. Raja.
Body language means facial expression without talking. You make feeling with your face that you are feeling sorry. This is the body language, I think. And the other language you can talk as this: I can see, It sounds so difficult time. I'm sorry for that. While the role player is talking, you express feeling of sorrow or sadness, or you are following her speech. Am I right?
Thank you very much, Dr. Raja. Yes, you're right. And yes, Dr. Muhammad Nias, want to add something? You can go ahead.
No, actually, what I understand is the open body language is just say yes or no, that not in the head, yes, no, disagree, agree, those body languages. And other one comes as just be quite silent, not agreeing what we are saying, the facial reactions, those things. That's what I guess.
Okay, thank you, Dr. Muhammad. Dr. Iram, you can also comment, please?
Yeah, for me, the body language is the two type of body language, verbal and non-verbal. Non-verbal is eye contact, your facial expression, your head nodding. While the verbal is, you are acknowledging, yes, yeah, okay, you are right. I mean, this is my understanding.
Thank you, Dr. Iram. Yes, exactly. That is what is body language. The verbal and non-verbal, both are very important. In addition to that, you should be very receptive. You should be listening to the role player. You should be looking straight into eyes of the role player. It means that you are very open to them. You should be sitting very confidently in the chair. You should not be either inclining in the chair or sitting at the very edge of the chair. And moreover, it's good that you don't cross your legs or cross your arms, or you're not shaking your legs, because some of the candidates, they don't know, and in the stress of the exam, they start shaking their legs, or they do some of the actions that show that their body language is not confident. So in addition to what Dr. Iram told, the verbal cues, the non-verbal cues, the ahs and ums and yeah, that is very important. So, and the tone of and pace of the voice, that is also included in the body language. So it's not important that you are always sad, or your tone is low, or you are in the empathetic mood. That only you will, when you are doing the bad news, you have to approach like that. But if you are talking to a colleague, you have different body language. If you are giving information, or if you are giving an education scenario, it's a totally a different body language. So for every scenario, you have to plan this in 3 minutes outside the station. What is the body language, and how I'm going to attack? Basically, this is the plan of attack, that how I'm going to approach the station. Now we will talk about the body of communication. This is the part 2 of the communication. So body is different for every scenario. And for most of the scenario, as I told the introduction, and the good news is that the ending is also same. Only you have to practice the body. It is different. But the components of the body are that you have to listen actively. It is very important that you listen and address what the patient is asking. It's not important that what you know and what your knowledge is, and that you are inclining and insisting to give your knowledge to the patient. No, it's important that what is their concern, what they exactly want to know. Now, then is they recognize the emotions. If they start crying, if they are angry, if they are in denial, do recognize them, acknowledge them. Don't make it a monologue. Keep it as a dialogue. As I told, that this is not a lecture, or this is not something that you are doing a class on it. So it's a two-way. The role player have also be asking question, and you should also be answering. So it's a two-way communication, and this is the actual meaning of communication, that the two person are talking. Then the other point is, don't speak in long sentences, because the role player usually they have 8 to 10 questions, and when you are speaking in too much long sentences, so you are not able to answer or finish it in time. And when you are not able to finish it, so you will not get the desired mark. Maybe there is a concern that is in the end, and you are talking in long sentences, you will not reach to the end. Then checking the understanding is very important, because this This checking the understanding, this has marks. This one has marks. In the next slide, I will show you how it carry marks. So it is very important when you give a small chunk of information, you ask the role player, is that clear so far? Am I marking myself clear? Is there anything that I can repeat for you? Then give factually correct information. Sometimes it happens, and it do happens, we're human, we don't know the answer of the question. So you should never, ever answer the question in a wrong way. Just tell them that, sorry, I have to check it back and I will come it back to you and I will update you regarding this. So they didn't mind it, as all of us know that we are human and we don't have every time we have a question answer ready for every question. So it do happen in real life also. Here is the domain E2 and E3, that is about the body of communication, and you are marked on these domains. So E2 is about the verbal and listening communication skill. See here, it applies active listening. Active listening has marks. When you will listen, only then you can answer and display interest with the role player. Interest means you are looking in their eyes, you are using your body language, you are showing them interest in what they are asking. Then allow other opportunity to speak. That is the also point which are covered. Appropriate use of the language. It should be jargon free. And if suppose you use any jargon, it should be explained. If you first is good is that you avoid using any jargon. But if you use any medical jargon, so you should clear it. You should give a clear explanation immediately after that jargon. Now we come to E3. This is about the managing concern and agreeing next steps. Seek, identify, acknowledge, and attempt to address concerns appropriate. We have to seek. Sometimes the concerns are hidden. So we have to ask the role player, especially before we are ending, that if there are any concerns they want to clarify anything, and they want us anything to repeat, then there is display the natural empathy with the role player according to the situation, check the knowledge and understanding. So these are all the anchor statements, and if you carry these all steps correctly, so you will get 8 out of 8. Nothing can stop you from taking 8 out of 8. Is the body clear for everyone? Do anyone have any question from the body of communication? Yes, Dr. Shanali. Sorry if I'm pronunciation wrong. Okay, if anybody want to ask any question from the body, so we will move forward then to the conclusion and ending. Okay, so in the conclusion, we have to summarize what information we have given. A conclusion, it's not, this is the important step, that whenever 3 minutes are finished, you hear the warning bell. It's not that you are in the situation, in the scenario, you are addressing the concern and you immediately or abruptly stop and you are going to summarize. No, it doesn't happen like that. Whenever there is the warning bell happens, you should ask the role player, is there any other concern? Is there anything that they want to clarify or they want to know more about? And if they have nothing, maybe there is one question, they have some hidden agenda and they want to only disclose it at the end of the communication station. So if everything is agree and they agree, and then you have to agree with them for the next steps and then summarize. Okay, summarize the information what you have given them, offer them further meeting. This meetings is very important because this is a type of support like that. You are here to listen to them and you're ready to solve their problems at any time. Safety netting is very important. This safety netting, in other words, I would say this is the red flags. You have to tell, like suppose if the child is not feeding well, if the child is not in himself, if it turns blue, so you have to come back. This is the emergency number. You have to, for emergency conditions like asthma, like epilepsy, you have to give the action plan. Action plan mean what they are going to do if this happens, if there is a acute attack of asthma, what they're going to do in the middle of the night. If they're living far away, they cannot bring their child immediately to the emergency, what they're going to do. So we have to instruct the parents, we have to give them action plan. This is in the written form. And then the alert bracelets are very important, especially in the conditions like if the child has hypoglycemia, if there is asthma, if there is anaphylaxis. These are life-saving. I must say this is life-saving because these alert bracelets, suppose if a child has allergy and a child is on steroids in these conditions. So alert bracelets is not for every condition. So they are selected condition in which we are giving the alert bracelets. Then provide written information leaflet. You can give any trusted website reference, and you can also refer them to the support groups. Support groups are very important for all of the diseases, like big diseases, any syndromes, any chronic conditions. There are support group available. And their support system is usually run by the parents of the similar, who have children with the similar condition. And there are some other volunteers also in that group, and they are here present to answer their any queries, and they also can coordinate with them how they are managing the illness of their child, what they are doing, and also from where they are getting medication. Each and every question they can answer. So this is the approach of the communication station. If anybody have any question, we can answer here till now about the approach of the communication. Okay, I think that's clear.
I have a question.
Yes.
I wanted to know that in which condition we can advise for bracelet wearing besides anaphylaxis and steroids?
Yes, if the child is on asthma, even asthma, epilepsy is very important, because if the child get unconscious and this child has epilepsy, so it's very important. Beside this, the Addison disease, in this also steroid is life-saving.
Yeah.
And child is having
But
hypoglycemia. Yeah.
do we advise epilepsy patient to wearing a bracelet?
The
Yes.
steroid intake, Addison, epilepsy, and the muscular diseases like Duchenne and SMA. I think they need to wear a bracelet. And arrhythmia, cardiac arrhythmia, I think, yes. Am I right?
Yes, exactly.
But I didn't
About yes. Yes. Okay, Dr. Iram, you asked about the epilepsy patient. Should they wear bracelet? Yes, definitely they should wear bracelet, because if they are going to heights and they are parking the road, and if there are fits in the middle of the road, or if they're going to climbing heights, so how you will know that they are having epilepsy? And fit can occur at any time. So definitely we're going to advise such patient the alert bracelets. They're life-saving. Is that clear now?
Yeah, can you please, when I was talking, another doctor was talking to, and you were talking to, so everything was mixing over there. So can you please enlist 5 or 6 conditions child need to wear a bracelet besides steroids and allergy or anaphylaxis? One is the epilepsy. What are the other 4 or 5 conditions?
Okay, yeah. I will tell you a few conditions, and I will also send the list after I finish the webinar. I will send the list in the group. Okay? So there is epilepsies first. The second is the multiple food allergies, or if the child has anaphylaxis reaction before, and even if no anaphylaxis only, but have multiple food allergies in that case, and if the child is on steroids, if the child has Addison disease, regardless of the steroid, it's Addison. In Addison, the steroid is life-saving. So in the Addison disease, and I will be sending the list of the condition in which alert bracelet is recommended. Is that all right?
Okay, that's will be okay with me.
Thank you, Dr.
Thank you.
Iram. Okay, do anyone have any question in the approach? So we should move forward. Okay, now we are going to talk about the bad news. What is bad news and which approach we should follow? Bad news. What is your understanding about the bad news? How will you decide in the scenario, communication station, that this is a bad news? So it's a very simple thing that if you are going to tell the condition first time to the parents, it means that they are not aware of this condition, and any situation in which there is no hope or there is threat to the person mental or physical well-being or risk of upsetting an established lifestyle, that is bad news for the parents. So before entering into bad news, we read the scenario, we categorize that this is the bad news. We have to, when we are sitting inside the 3 minutes, we have to prepare. So ideally, in the exam, the setting, these are the ideal setting. We have no need that there should be a place and where there will be no beeps, no interruptions, nobody will be there. So I omit these and I modified according to the MRCPCH exam, what actually we are going to do there. So I omit the settings and the interruption part. I started from the now know the background information. So know about the information that you have already read in the candidate information sheet that was provided to you, and also know about the condition knowledge wise, like how this condition is managed in your hospital and what is going to be done in this condition. You should prepare in your mind how you will then second is the decide the plan of attack, how you will enter in the scenario. Is you are going to use the background information, if there was some test that you are going to disclose, or you have done certain examination. So, and also third is the empathy, and fourth is the soft tone. So you should be preparing the mind, like what should be the body language, as I discussed the open body language, what should be your facial expressions, and what should be the tone of your voice. So that should be match the scenario. So here, what is already known. So we do the introduction in the same way. We clarify our role. We clarify. We clear the identity with the role player. Then we always ask about the attender in the breaking bad news, and we take them consent. Is this the appropriate time to talk to them? Then we come to previous knowledge and checking the understanding. So if you do not ask about the attender in breaking bad news, so it's a pass and fail criteria. They are going to downgrade you. It's mandatory to ask about the attender, especially in breaking bad news scenarios. All right, we have to check about what is already patient know, check their level of understanding, avoid jargons, ask an open-ended question. So you can ask in any of the way. I have written 3-4 ways. So do you have any idea what the problem might be? What do you understand about your child? What do you know so far about your child condition? What have you been told so far? This is an open-ended type of question. Any type of, from these, any one you can select and you can practice on it and you can memorize it and you can ask. It's a very good way to enter into scenario and wait for their response, what they know already. Then before breaking the bad news, it's very important not to deliver the bad news suddenly. There should be a warning shot. So these are the magical words, and this make you different from other candidates if you use the words like "I'm afraid." Unfortunately, you have to break the bad news after saying these words, and they will make a very good impact. Then deliver the bad news. Be direct, come to point swiftly, like within 1 minute of starting the communication, you should deliver the bad news. Don't do a preamble and here and there and move there. No, you should deliver the bad news within 1 minute. Then pause, allow time for silence. Don't rush for words. There will be emotional response definitely that will be coming from the side of the role player. If they start crying, offer them a tissue. This is a pass-fail criteria. and stop, pause here, don't talk, let them feel out, vent out their feelings, never interrupt them while they are talking. So this is very important. When you break the bad news, it is you pause for a moment. In the exam, it may be look awkward that it is a very long pause, but it's not actually. It's a part of the empathy, and it's important to pause and see for the emotional response. Then you have to show the empathy. You have to identify, explore, understand, and respect the empathy. Name the feeling. Maybe you can say that I know this is very upsetting. I can see that you are very sad and it's natural. Then understanding it would be for anyone. Respect, you are asking all the right questions. Support, we will do everything we can help you through this, and you are not alone. So maybe this is all a part of this empathy. There are two types of role players. Some role player, they will be sad, they will be angry, maybe they go in denial, maybe they blame themselves. Any type of response, there can be any type of response. So it's important to acknowledge the response and name the feelings. When you name the feelings, so it lessens their pain, and this is counted in the empathy. So never ever say to the role player or the mother that don't worry. It doesn't give a good impression. Always use the right tone of the voice, use the right words, and you can use the phrases like, it's very upsetting, and I know it comes as a big shock for you, and your worries are totally understandable. It's very natural to feel like that. Anyone in your place will have same feeling. So you can have a bunch of sentences, different sentences that you can use while you are dealing with the empathy. After this, all the emotional reaction that has happened and the mother has went out her feeling, then you have to provide information. And before providing the information, just ask them, is it okay? Should I continue? If they agree, there are different types of people. Maybe some people want to know more about the condition. Tell them according to their understanding, whatever they want to know. If they want to know more about this condition, you can tell them more. But if they're not ready, so you can give them some time. They may need some time to absorb the bad news that has been delivered. You can offer them a glass of water. You can offer them that maybe if they're not feeling well, so we can talk a little bit after some time. But in the exam, usually it's because it's a stimulation, it's not the real scenario. So usually after like a brief emotional response, and if you deal it in an accurate way, and you answer them, you show them empathy, the right tone, and you acknowledge their response, then they are open to get more information. So first of all, it is important you establish a common knowledge base. Provide them new information, and that should be in chunks. Don't give them very long information. Information should be clear and concise. Then you are going to tell about the implication of the new information. What condition you told, then you have to tell about these conditions. Answer their concerns honestly and sincerely. And then talk about what is going to happen now. It's all is the part of the information. This, I have a graphical presentation. This is the, here it is shown that it is the patient, this is the patient level of understanding. It's on the baseline, and the doctor level of understanding is here. This is the information gap between the patient and between the doctor. So we have to give them information in a stepwise manner, and that cannot happen in one discussion, one meeting. So we have to give them only one step knowledge. Like, this is the patient preferred level of understanding. In this meeting, we have just to tell this much knowledge. You have not to tell them too much knowledge, because they are already in a shock. They cannot absorb the information. They cannot retain the information. Okay, in the end, you have to summarize, you have to give the strategy. Always before summarizing, ask the role player, do they have any concern? Did they want to repeat you anything? Is that clear for is it clear? Did they want anything to repeat? And then give them the plan of treatment or care, address any concern before for finalization, foster the hope and support. So always say that you understand you are here, that I assure you that we as a team would support you throughout. We will not leave you alone. We're here to help you. These sentences really make a difference. Give them the written information and support groups and offer them another meeting. So you can offer them the same meeting which happened now, but they didn't hear anything properly due to emotions. You can and you can also offer them after they read the leaflets which were provided, they can do another meeting in which you will answer their more queries, other queries. So till this point, everything is clear. So if anybody have any questions, so we will answer these questions.
Hello. Hello.
Yes, go ahead.
Yeah. Hi, doctor. Like when they go like when I'm breaking my news and they go like sad, you said, I mean, to offer them the glass of water and to offer them like sort of tissue. So is it available, like, or should I pretend that I'm doing that to the royal player? Are they available in the exam room?
Thank you, Dr. Salahuddin, for asking such a nice question. Actually, they are not available in the exam. This is all about the stimulation, like it's not present in the real exam scenario or in the real exam setting. So you can just say this. Could you should I offer you a tissue, or you will offer them a tissue? Could you please could I give you a glass of water? Is it okay to talk to you? Because all these things, the situation is also, this is not the real mother, this is the role player, and all this situation is the stimulation. So you are going to tell all these things, they are not present there. Is that clear?
Yeah, it is. Thank you.
Thank you. Did anybody have any question regarding the approach in any steps, about the empathy, about the tone, about the intro, body, summary? We should clarify it before we do the actual scenario. Okay. So Dr. Abdul Wahab is here. Thank you, Dr. Abdul Wahab, for participating, and I appreciate really this effort. And this is the scenario. I will give you 3 minutes to read this scenario, and then we will start it. Your time starts now.
Okay. Okay, doctor, we can start.
Okay. Please start.
Okay. Hello, my name is Dr. Abdul Wahab. I'm one of the pediatric registrars working in this hospital and looking after Benji. Am I talking to Mrs. Janine?
Yes, doctor, it's me.
Okay, and you are mother of Benji, right?
Yes.
Okay, so doctor, how are you feeling, Mrs. Janine? I'm hopeful that you're recovering soon from the...
Thank you. Yeah, I'm recovering. I'm feeling better now.
Okay, so Miss Benji, so Miss Janine, I've made arrangements for this meeting that nobody's going to disturb me. Do you want anyone else to be in the meeting, like your partner, your husband?
No, doctor, actually, my husband is busy and he's out of the station, so he will not be joining.
Okay. Okay. Okay, so Ms. Janine, I just wanted to ask you that did you notice anything unusual about your baby, like Benji?
No, doctor. Is everything okay? I think he's all right. He's fine. What happened to him?
All right. So as I said that when we were examining Benji in the neonatal unit, so we have a suspicion of some unusual features in your child. So I just wanted to tell you about that. So first, have you ever heard about something as a disease known as Down syndrome?
Doctor, what you're saying, I don't know. I don't understand. Are you talking about Benji?
Yeah, I know. I'm very sorry to tell you this, but I just wanted to ask you that have you ever heard about this disease, or have you seen a child with this Down syndrome?
Doctor, I have seen, but you know, how can be this possible? I'm trying for pregnancy for the last 6 years, and this is my first baby. How is this possible that Benji is having Down syndrome? It's not possible, doctor. Can you please check
yes,
it again?
Yeah, Miss Sineen, I'm really sorry that I have to break this news to you, but you see, Down syndrome babies have certain unusual features. Their physical appearance is slightly different from other children. So we have a very strong suspicion when we examine the baby. I just wanted to brief you about this because now we would like to do some further confirmatory tests. We need to do some blood test on your baby, and we need your permission for this, and this will confirm the baby's diagnosis.
Oh my God, doctor, he's such a small, he's just 10-year-old, and you're telling about the blood test. How can this is possible? When I was pregnant, I have done all the tests. They do my blood test, they do my scans, and they tell everything is normal.
Yes, Ms. Sineen, I'm really sorry. I can understand this is a very shocking news for you, and I don't have words. I cannot share the pain. But you know that it's not necessary that we can screen this for this disease. These tests that were done in your pregnancy, they're not like 100% accurate. They can predict the chances, but still we have seen cases even with the tests are normal. So unfortunately, this is why we have to do some tests on your baby. And why
Okay,
it is,
doctor.
this is, yeah.
So doctor, like, have I passed it to my baby? You mean to say like that?
No, it's not like that. You have not passed it, your baby. It's not your fault, and there's nothing that you could have done to prevent this. It's just not this condition is just, you know, there's a chance of these babies, like you can see 1 in 1,000 chance. So there is nothing like it's your fault or your partner's fault. So you don't have to think like that. So what we can do is like we have to do the test, and if when the results come, then we'll have to do some screening. You know, we have this Down syndrome can also affect certain other systems like the heart or the ears. So we'll also have to check him further that if he has any tests. Okay, are you following me?
Yes, doctor, but you told it that you will be doing some tests, so you are not sure yet, this means.
Yeah, okay, so we have a very strong suspicion. Why? Because right now we just looked at him, and Down syndrome has certain, unusual features on the face, hands, and while examining him. So for 100% confirmation, we need to do the blood test. So we do a genetic test, see. So we take a blood sample, and that will give this 100% confirmatory result. And then we'll proceed further.
Okay, doctor. So what is going to happen now? Can I take Benji home?
Yes, we'll guide you about the routine procedures. We'll hand over the baby to you. We'll do the initial checks before discharging the baby. And once he has established the feed and both of you are good to go. So after we have done the test, you can take the baby home. And once we have the results back, then we'll call you back, and then I'll guide you further how to go about further testing of other, like testing of his hearing and his heart and some other tests.
3 minutes left. Okay, doctor, I have seen in the TV that these children with Down syndrome, they are slow, they go to special school. So will Benji having all these problems?
Oh, yes, Ms. Janine, I'm sorry to tell you, but most of the babies with Down syndrome do have this learning disabilities. But this depends, it varies from every child. Like some children, they can even attend normal school, but some children would unfortunately will not be able to do that. So right now, it's very difficult for us to predict that. And we'll just gradually see how he grows up, and then we'll be following up with that.
Okay, doctor.
So, so to summarize, Ms. Janine, so I would like to apologize to you. I'm feeling very hard to tell you this, being this is your first child, but now we would like you to go home, study about this as well, discuss with your family, and then after the results are here, then we'll have further tests, and we'll continuously follow up with you, and we'll further guide you about this as well. Okay. And are you there with me?
Yes, doctor.
Yeah. And I'll give you some information leaflets, and there are support books as well, and certain websites. I'll give you the literature. You can also go home and study that. It will be helpful for you as well. Is there anything you want to ask?
No, doctor.
Thank you so much, Ms. Janine, and I wish you all the best, and thank you.
Thank you. You still have 1 minute.
Okay.
Do you want to do anything else?
No, I guess I just summarized, and the mother didn't have any questions.
Okay. So thank you,
Okay.
Dr. Abdul Wahab. I must congratulate you, have done very good effort, and you have very positive things, which I will discuss now. So you have asked about the attender, you introduce yourself, you check the identity, you ask about the consent. It's a proper, like in the proper way, you can ask, I'm here to talk regarding Benji. So is this a suitable time for you? It's better to ask in this way.
Okay.
Okay. And then you ask about the attender, you check about the previous information. But here in the previous information, you told that, do you have noticed anything unusual? So it's like, it's not the appropriate way, I would say. So just you can say that, how is Benji doing? And have you seen Benji today? Has anybody talked to you anything about Benji? Then she will say no, or because she don't know anything about it. So, and
Okay.
yeah, then in the breaking bad news also, you have interrupted mother twice. I have written here that you were hurry to tell more about the what is going to do. We will do the blood test. So it's better to not to hurry and listen to them, not interrupt them, because I already discussed in the start. Pause, offer them tissue if I was crying, offer and then always ask him, should we continue? Are you feeling okay? Should we continue? Could I offer you a glass of water? I offered them a tissue. Again, please take this tissue. Yeah, I know this is very upsetting, and it's very hard. Your worries are totally understandable. This is this come as a sudden shock for you. You were not expecting this. All right. So this is her first
Okay.
baby. Yeah. And empathy in the start was, I will say, yeah, you need to work on your empathy skills more, and you have to
Okay.
pause a bit, give the mother time to absorb about the bad news. And then better not to interrupt, they will ask, they have the question, they have a set of questions. So I ask you in the third place that what is going to happen now. So you told me that, yeah, we will do the blood test and we will confirm it. So how it happened, did I pass it to my baby? So the here answer, maybe you can draw something outside, or you can see that say that in our body there are certain genes or chromosomes that carry the genetic material, and what happened that normally they're arranged in the form of the pair, and normally they are in the form of pairs. But what happened in the case of the Down syndrome, there is an extra pair at chromosome number 21, sorry.
All right.
Yeah. So is that clear? You can draw it like that.
Okay.
Yeah, this will give a good information, impression, if the role player want to know more about it. And then you discuss about the clinical features. Very good that you say that you have a strong suspicion and you want to do certain tests. Then it is important that you emphasize, like, currently at the now what we are going to do, and later on what we will be going to do. So currently it is very important that you will observe the feed, as you say. And also there is some of the babies with Down syndrome, they have they have lazy gland. So we will be doing testing for this, that his gland is okay. And also some children with Down syndrome have heart problems. So we will arrange a jelly scan before that. So you have to tell about the jelly scan. And later on you tackle in a very good, excellent way that you told that we cannot predict it now, and maybe he develop normally or he needs support. And in the end, you can before summarizing, you can ask mother, is there any concern that you want to clarify me? And then you say, I understand that I have given you a lot of information, and it is a lot of information to take all in one go. So let me summarize what we have discussed today. Then you give her summary. And I will also suggest you to always include the support groups. Support groups have a very good impression. Then you can tell that I can connect with you some Down syndrome support groups. They are very they have the parents who have Down syndrome, and you can see how they are dealing with their children and how they're taking care, and how happy they are now. And these children are growing, they're very beautiful children. Written information you have provided, and also second meeting chance you give. So I say that it was an excellent attempt. Only you have to a little bit more emphasize.
Okay, thank you. Thank you.
Doctor, I have one question.
Yes, please.
Okay, thank you. Like in this case, do we need to congratulate mother about the newborn? Do we need? I mean, should we say like congratulations for the baby or for the newborn baby? In this case.
Thank you, Salah. Yeah, thank you, Dr. Salahuddin. You have again raised a very, very important question. So yes, you can congratulate here. I will say that don't congratulate in any condition that is life-threatening. Suppose if this is a baby with hypoplastic left heart syndrome, or this is a baby with congenital heart defect with complex problems, cyanotic heart disease, you are going to transfer this baby. So anything that is fatal and life-threatening, don't congratulate there. But here, if you see that the baby has a good prognosis in Down syndrome, you know, a lot of children are Down syndrome now are surviving. So it's not a hard and fast rule that you cannot congratulate. There is a lot of controversy going around it, that whether congratulate or not. But the best thing is that don't congratulate in any condition that is fatal or life-threatening. Is that clear?
Excuse me, doctor.
Yes, Dr. Dina.
What conditions shouldn't we congratulate the mother again?
Yes, any condition that is life-threatening. I give you one example, like suppose a baby is diagnosed with a hypoplastic left heart syndrome, because this syndrome is need a lot of surgeries, maybe they need 3 or 4 surgeries, they have to spend about 80 to 90% of their life in the hospital, and the outcome is not good. And the definitive treatment is heart transplant. In that case, you should not congratulate. Or if there is a baby in which there is a cyanotic congenital complex heart disease. So, and you're going to transfer this baby to another unit, you are starting the prostaglandin. So it's better to avoid congratulation in this case.
Yeah,
Because that will not set the tone.
Yeah, I got it. Thank you.
Okay. Doctor, anyone have any question? Yes, Shalini.
There are certain condition like scenarios where when you have to tell the parent about the brain death and stuff like that. I mean, those scenarios, you don't have to talk about these written information and all those things, right?
Well, this is again a very good question. The brain death usually at the registrar level we are not doing, and these scenarios are usually not coming in the exam, but they can come. And in that case, that is done by the consultant in the NHS, the brain death.
Right,
and
right,
this is not the decision of one doctor. They will sit down, then they will do a stage disclosure. There will be a lot of meetings, and after this, that will be disclosed. So it's not possible to do it in the 9 minutes. And this will.
Because we've seen those in books. That's why it's like somebody with like a SMA and myopathies, and I think there are certain scenarios in the past test book where you have to say like withdrawal of care and those kind of things. That's why I asked.
Yes, thank you, Shanali, for your question. And yes, there are very rare chances to come and exam this type of scenario, because I told you that they're done by the NHS consultant, because these are high profile. Like at our registrar level, ST4, we are not going to do these scenarios.
Okay.
Thank you. Anybody has any questions that we move to next scenario? Okay, so we will move to our next scenario. So Dr. Sabyasachi.
Yes, hello. Good evening.
Hello.
Good evening, everyone.
Good evening.
Yes.
So Dr. Sabyasachi, your station start now. I will time you 3 minutes. You can prepare your station.
Okay.
Yes, you can start,
Okay.
please.
Okay. Good evening.
Good evening.
Am I speaking to Mrs. Julia?
Yes, doctor.
Okay. And you are definitely were William's mother, is it right?
Yes.
Okay. Hello, I'm Dr. Shobhusachi Mukhopadhyay. I'm one of the pediatric doctor of this hospital. So is it good time to talk to you regarding William?
Yes, doctor, I'm here and want to know about it. You know,
Yeah,
he's
yes.
advanced in the last few
Uh,
weeks.
mhm. So is there anybody who would like to join this discussion?
No, doctor, my partner is busy. He is at work. So you can talk to me.
Okay. So basically today I'm here to discuss about the uh, Williams blood report and to explore your concern as well. So before I start off, I just want to know how much have you come to know about William?
Yes, Dr. William was unwell from the last 2 weeks. He was having fever, was having these bruises
Mhm.
and having this
Okay.
shortness of breath. And therefore, I brought him
Okay.
today to the emergency and they do some blood test. I'm
Okay.
thinking that I don't know why he is perfectly all right before. And he's from the last two
Mhm.
weeks, I don't know what happened to him.
Okay. So I just before obviously as discussed, I just want to know. I mean, what is your perception? Why did doctor test for this all this investigation? What do you think? What? Why doctor did so?
Doctor, I don't know, but I
Okay.
have no idea about it.
Mhm. So, Mrs. Julia, I'm extremely sorry to share with you that we have the result of William, and I do not have very good news for you today. So, basically, William's blood report is showing that his uh, few of the blood components are, not, you know, the level of the blood components are not normal level. So at this particular level, when we get this type of result, we stamp this disease as we are suspecting that this disease may be acute lymphoblastic leukemia. Have you heard about this disease?
Doctor, what you're talking about, I don't know. I think that this is just a common cold. He came with a common cold.
I understand that it's really a matter of concern for you. So basically, I'm going to tell you that this is one sort of uh, uh, blood cancer.
Oh, doctor, are you sure it's a blood cancer? How? It cannot be possible, doctor. He's all right. How can this happen?
Mm, yes, I understand.
Doctor, it's not
It's
possible.
really a shocking moment. I mean, for you, I understand. But I can tell you that we are living in a very highly, well medical. I mean, we are living in an era where medical facilities are available. So, exploring your concern, I'm fully with you, and I'm here to discuss about this uh, uh, blood cancer. So, should I progress?
Yes, doctor. So what will happen now?
Yes, I understand that you are very much concerned. So right now, we have consulted, uh, uh, Williams report with our very senior consultant and cancer doctor as well. And right now, we need to test for few blood tests and we may need some, brain fluid for examine. And after that, when we have those all reports, we can tell you the what type of cancer it is and how we will progress further.
So, doctor, why it happened?
Yes, yes, Mrs. Julia, are you with me?
Yes, I'm here. And so, doctor, I'm asking why this happened. He was
Okay.
all right. Nothing was there. So how it happened and why it happened? And what is this blood cancer? Can you tell me more about it?
Yes, I understand about your concern. So basically, this blood cancer is why this has happened, uh, Mrs. Julia. I'm extremely sorry that uh, what exactly it like other cancer. I mean, no one is responsible for this. But the thing is that in particular, this situation where it is a in our blood there are various components, there are various cells are there. So basically in this disease, what happened, the factory of this blood components are somehow not working properly, and as a result of that, uh, the proper shapes of these blood components are not, I mean, the blood doesn't have a proper shape of blood components. As a result of that, it's not working properly. So basically, here is the problem. Are you with me, Mrs. Julia?
Yes, doctor. 3 minutes. So, doctor, I'm very much worried. Is there any treatment? Is he going to die now?
I understand how much concerned you are. So basically, yes, I can tell you this. Yes, there are treatments, and obviously, we will very soon arrange one meeting with our very senior consultant and the blood cancer doctor as well. So we can discuss in detail about the treatment option we have, and definitely. But before that, we need to reach what type of cancer it is, and for that, we need to test further. And
So,
yes,
yeah, doctor, is this something serious? Is William going to die?
it's really a difficult time for you, Mrs. Julia. Uh, I can tell you that we all are with you at this particular moment. And let's first blood report let come. And I can tell you that there are many types of blood cancer which are not so fatal. Okay, with treatment, many children are doing better. I can give you a group number where you can see that there are many children over there. There are many parents over there who are doing really good. So let us hope for the best. But as you can say in medicine, we cannot say 100% to anything. And I'm extremely sorry to share you that unfavorable prognosis is not unheard of with this uh, blood cancer. But it all depends what type of cancer it is.
Okay, doctor.
Mrs. Julia, is there anything I can help you more?
No, doctor. I need some time.
So, yeah, I understand, Julia. Please, would you like to have a glass of water?
No, it's all right.
Okay. So let me summarize, Mrs. Julia. Basically, I'm extremely sorry to share you that the blood report is not favorable for William, and it is showing a blood cancer that is known acute lymphoblastic leukemia. But we are at this situation, we are all with you, and definitely we will share you our next option and what we are going to do with William. So we are all with you once again, I'm saying, and uh, I wish a very quick recovery of William. Thank you.
Thank you, doctor. Your time is up.
Okay.
So thank you, Dr. Sabyasachi. You have done a very good effort. I must appreciate you. It's need a lot of courage to come in front of the audience and perform. So yeah, it is a very good effort, and you should continue participating like that. Now I will tell you some of your positive point and some of the point which can be improved more. The positive points was that the introduction was very good. You entered in the scenario, you introduce yourself, ask about the identity, check about the timing, is this appropriate time, ask about the attender, and then you ask about the previous knowledge. So in the previous knowledge, it's better that if you directly ask, like if the role player will say a long story about the William, like what do you know about William? Maybe I am going to tell you a long story. It will take your time. So it's like I told you, and it I take almost more than 1.5 minutes to tell you, like he was having fever and these things. So just come to the point. I'm here to talk to you regarding William's condition. So and I understand that he has some blood tests were sent. Did anybody update you regarding the blood test report? So come to the point directly, because you are here to talk regarding that blood test report. So here, the previous knowledge is not about the previous 2 weeks, what was happening, but previous knowledge is about when he was brought to the ER and when the blood tests are done. So did anybody update him about the report? Is that clear?
Yes, clear.
Okay, thank you. And then you break in the very good way that I'm afraid to tell you that I have no good news for you. And unfortunately, so here, tone of the voice. So you have to lower the tone here. Okay. So you have to do some show empathy. Empathy means like you have to put them in their shoes, and you have to do the same feeling what they're going through. You have to acknowledge it. So just lower your tone and make a face like that. I'm very sorry to tell you. I'm afraid to tell you. Unfortunately, his blood tests were not as we were expecting. And the reports are here, and I've seen him. I've seen the reports, and they are showing that he's having blood cancer. Don't say leukemia, because more of parents don't know about leukemia. First say blood cancer, then you can later say acute leukemia. Then just stop here. You give a pause. It was a very good attempt of you. You give a pause, but here wait for the emotional response. Don't ask like you have heard before this or not, because maybe a mother has a very bad experience, or she has not heard it before. So it's better here to pause. So maybe she, like I told, no, this is a denial. I say that this is a common cold. So you will not say, no, don't worry, or no, this is not a common cold. And you did very rightly. You do excellent step that you told, no, I'm very, I know that this is very upsetting, and I can see that it's come as a shock for you. You were not expecting, and I'm really sorry, but the results are showing that he's having the blood cancer. Then you have to do some drawing here also, and you have to explain what is blood cancer. You directly jump here on the treatment. So you say something that advancement in the treatment. No, because first I have to see what is the cancer, and so it's I will do some drawing here. Okay. Yeah. So you can draw here a bone like that. So normally what happened there inside, this is the bone factory. Here, when you are giving the information, so you can have a normal tone, but whenever you are breaking the bad news, your tone should be very low. In the information section, when you ask the mother, is it okay, should I go further proceed and break and explain it more for you? If she agree, then you have to draw it, and you say that inside our bone there is a bone factory, and there is a spongy material which produces the white blood cell, and they are fighting with the infection. So what happened in case of William, that these cells, they are produced, they are producing in high number, but they are immature and they are not functional, although the count is high, but they are not doing their proper job. Am I clear so far?
Yes.
Have to check the understanding here.
Yes.
Is that clear now? Till this point, do you want to ask anything? Okay.
No.
And because of this cells are produced so much in amount, so there is no the bone is not bone factory is not able to produce the red cell which carry the oxygen, and they're also not able to produce a type of the cell that help in clotting of the blood, and therefore, and that's why he was pale and he is having these bruises. Now you explain all the things. Now the role player will ask why it happened. So the exact cause is not known, as you say. That was a perfect answer. And what we are going to do, So it's a better idea that to say that we have a very specialized team of doctors in our hospital. We are going to involve them, as you are already in the hospital. So we will be doing further more tests to confirm it. And for that, we will be putting a small needle inside the bone and take a small sample of the bone and see about the type, what type of cancer this is. And we will be doing further more tests, and we will be involving these doctors. They're very specialized. Is that clear till now?
Yeah.
Okay. When she is asking about will my child die, so there is no yes or no answer. Here again, you have to show the sympathy and empathy. Empathy is very important, and then you have to tell that that the majority of the cases with the advancement in the medicine and good treatment is available, and with good care and compliance and expert specialized doctor, that we have majority of the children do have a good outcome, because 95% of the children do cure with ALL.
Good.
You have to give them hope. And we are here to support you at every step. We will not leave you alone. So you have to say these sentences in the end as well. So again, like I'm saying that how much empathy you can put here is not, the station is not about the information giving. It is again about the empathy. So the more you put the empathy, the better it will be. So you will be high chances to get 8 by 8. However, you do a very excellent effort. I must appreciate it. And you ended it, you give the support group, you can give them the written information. And if the patient is admitted in the hospital, so you can just say them, we will arrange a meeting with a specialized doctor. You will have chance to sit with them again, and they will talk to you regarding more tests will be carried out. And we'll have the chance to talk to me again. We are all here as a family. We are here to help you. We will not leave William alone. We will support him. Other was perfect.
Okay. Okay. Thank you very much. Thank you.
So,
thank you.
Do anybody have any question regarding the 2 scenarios that we have done, or about the communication approach, breaking bad news?
Ma'am, can I ask a question?
Yes, please, Dr. Niyas, go ahead.
Yes. Yeah. Regarding this, in this scenario, when we are breaking the bad news, is it advisable to give, say that I can give some leaflets and give some website links to go through this, because patient already in the hospital set up, because she won't. Yeah. In this particular scenario, you can give. It's not like a hard and fast rule. You cannot give. Even in the hospital, in the NHS, when you go there are printed leaflets present over there. So anybody can take it. And yes, you can give, why not? But in the hospital, you can say that, like, you can have a chance to sit with them again. I will come to you again after a few times. You can also read this. If you have any question, you can write them down. We can talk, discuss it again. And here you have a chance to arrange a meeting with a specialized doctor as well, because the child is in hospital. And also you have to tell that you can tell that we are going to admit and we will be doing further testing. Okay, thank you. So I want to make it as much as interactive as possible. So yes, please, Dr. Abdul.
Doctor, when we asked about concern about what is the reason of leukemia, answer of problem in the blood product, is it enough?
So we can answer this like that. With all the advances in medicine, the cause is not clear yet, because we don't know the cause. Nobody knows the cause.
Cannot see multifactorial like viral or radiation or other risk factor of cancer?
Yes, but it's not a history station. You're not going to ask that, is he exposed to his radiation? Is he having some viral infection? So it will convert into history station if we are asking these questions. Or and the second thing is that you cannot answer one question in very much detail. You are right. There are certain causes. If the child has exposed to chemotherapy, if the child is exposed to radiation, if the child is having some viral infection, genetic predisposition, there are a long list. But we have to give a short answer. Like your answer should be 30 seconds. It should not be more than 30 seconds. So it's a better idea that if you can say like that despite all the advances in medicine, the cause is not clear yet, because we don't know.
Okay, thank you.
Thank you. Yes, anyone have any question?
Yes, Dr. Maimoona, I have a question.
Yes, Dr. Salahuddin.
Thank you. Dr. Maimoona, actually, the scenario, I'm not quite sure whether like it's okay like that, because, you know, as I said, I mean, the results came back with a blood cell that like can be an indication or indicator to for the child to have leukemia. So in this case, actually, when I'm breaking bad news to the mother, like, you know, I'll tell her, sorry, I'm afraid to tell you that, I mean, the result came back with like abnormal cells in the blood test. And of course, I mean, I need to follow it with like, it might be, so there is a possibility to be, because the confirmatory test will be like, as I said, the bone marrow biopsy or aspirate. And then, so I need to explain the procedure in case that she asked me how. So in this case, I mean, the flow of speech, when I'm saying, you know, it might be, you know, a leukemia or a blood cancer, as the colleague said. Should I continue to go deeper and deeper explaining about the leukemia before that, you know, I'm telling her that this is a possibility that the child...
Yes. Thank you, Dr. Salahuddin. This is a very important question you have asked. Yes, because, you know, there is a suspicion, and your task is this, that you have to talk about the diagnosis of ALL. So you have to explain it. You can say that we are suspecting that it's very highly likely that he's having the blood cancer. The results are consistent with this. As we done in the previous scenario, also the Down syndrome. Here in the Down syndrome, again, because the physical characteristics were very obvious, and you have a suspicion, again, that was not confirmed. We have to do the karyotyping, the genetic testing, but we are going to tell the parents. We cannot wait. Similarly here, the child is pale, the clinical history from the 2 weeks, the age, the bruising, the lethargy, and the blood test, all are going with leukemia, suspicion of leukemia, so we can tell about it.
Yeah, okay, that's good.
So if nobody have any questions, so we will finish this here today. And I am very delighted, and I'm very thankful to you all for joining today. Remember, this is a learning journey, and each webinar you will attend will bring you one step closer to your goal. So thank you for being the part of our learning community. And we will be bringing more and more these sessions for you. Stay in touch.
Dr. Maimoona.
Thank you.
Yes.
That's great session. Thank you.
Dr. May I ask a question about the intensive course? Do you do like mock exam, like, you know, mock exam or mock like sessions for the, you know, especially for the scenarios that they come frequently in the exam?
Yes, we are doing the mocks, and we are doing the intensive course also. The intensive course will go to start from the 1st of October. And if you're already accepted in the exam, so we have a mock scenario for you also, in which we are doing the past recall stations in a exam stimulated manner. And it's a very good chance if you want to assess and you have you want to have some feedback before exam. So it will be a very good idea to take the mock.
So you do these like scenarios that they come frequently in the exam, Dr. Maimoona? Do you like do them as like in the intensive course?
Yes, we are doing in the intensive course, we are doing all the scenarios, all the recall stations that are coming in the exam. Either it is history, it is communication, radio station, development, everything that is come in exam, it is a comprehensive course will be covered in the course. You don't have to worry, don't to read any other book after joining the course. You will get all in all.
Yeah, and for how long the course will be like lasting? For?
Yes, this course is for 6 months. So if you are planning to take the exam next year, it's the best time to enroll in the course. You will have a chance to practice with the mentors. We are a group of 3 mentors. 2 other are there, Dr. Zahid and Dr. Rabia. And there will be real live sessions. There are 45 sessions, and all the sessions will be very interactive, and all will have the previous exam collection and tip and tricks and strategies, how to ace the exam, and how to approach. Everything will be discussed in very much detail.
And how many sessions per week for the intensive course?
Yes, we have like 2 sessions. And if you want to know more, so we will provide you more updates about it, okay? I will request the admin team, and they will reach out to you to provide you more about the insights of the course.
That's good. Yeah. Thank you.
So thank you. We will end our session here today. And I wish you best of luck for those, especially who are exam going candidates, and be relaxed and stick to your approach. And you have done the best of your job and studied hard. And soon you will be passing your exam, and you will be giving us feedbacks. So nice to meet you until I see you next time. Thank you.
Thank you.